a very favorite MCQ topic. We are in growth hormone. There are certain factors which increase growth hormone. There are certain factors which decrease growth hormone secretion. What they frame that MCQ as exactly from this table in front of you. I'll tell you the MCQ first. Which is considered to be the most potent factor for growth hormone secretion. If this factor is present in human body, growth hormone level rises within a fraction of a second. Such a powerful stimuli. What is that? The answer is very simple. Blood glucose levels. Make a note of this point. Decreased blood glucose or hypoglycemia. Exact MCQ. Hypoglycemia is the most potent factor for growth hormone secretion. You can automatically relate this physiology information clinically. Sitting in OP, a diabetic patient is coming to you today. You are giving insulin dose for him in the night. The next day morning, he is coming and complaining to you, I am having an episode of hypoglycemia. Any idea what is this phenomenon I am talking about? Whenever you are going to give insulin, there is going to be hypoglycemia. Automatically body produces certain counter-regulatory hormones that increase blood glucose level. The most important counter-regulatory hormone is going to be growth hormone. Connect the dots here. Decrease in blood glucose, growth hormone level rises. So automatically blood glucose rises in a diabetic patient in the early morning. That is why this phenomenon is called as dawn phenomenon. DAWN. It is because of growth hormone. Hypoglycemia increases growth hormone. I often see lot of students memorizing this table. Not going to help you at all, guys, in any way. Understand it conceptually. Hypoglycemia is the theme. Exercise, glucose is utilized. There is going to be a state like hypoglycemia. So automatically growth hormone level rises. Anything concerned with the stressful stimuli, hypoglycemia happens, growth hormone level rises. Anything concerned with hypoglycemia, stress, starvation, fasting, exercise, all increases growth hormone secretion. A very recent MCQ, look here, there is a gastrointestinal hormone recently shown to increase growth hormone secretion. It is also conceptual MCQ. Look here, very simple concept. Exactly around 12:30 p.m. in the afternoon, what happens? We get the feeling of hunger. This hunger is because of an important hormone, ghrelin. This hunger is also because of hypoglycemia. That is the connecting dot here. Ghrelin, hypoglycemia, it increases growth hormone secretion. The theme for increase is always hypoglycemia. Last important point. With respect to sleep, whenever we sleep, certain hormone level rises. One important hormone is growth hormone. Look here, this particular sleep where delta wave appears in EEG. It is called as NREM sleep, non-rapid eye movement sleep. This delta wave appearing sleep is also called as deep sleep, D for D. It is in this stage growth hormone level rises. At one side, what we discussed is the factors which increase growth hormone secretion. Now look into the other side. It is even familiar MCQ nowadays. There is a common theme in endocrine physiology. I will ask you this question. Cortisol is a hormone. It goes to anterior pituitary and it inhibits another important hormone from anterior pituitary. Remember what test I am talking about here in clinical practice? Dexamethasone suppression test. You all remember that. Dexamethasone is a steroid. It suppresses ACTH from pituitary. So what type of feedback is that? It is classically called as negative feedback regulation. All the endocrine hormone regulation falls under this category. Growth hormone being a hormone, it is always inhibited by a factor which is called as somatomedins. Kindly underline this point. Somatomedins, whenever it is there, it always inhibits growth hormone secretion. A very vital point to be noted. Much of the actions of somatomedins resembles like insulin. That is why they name these factors as insulin-like growth factors. In simple terms, they are called as IGFs. Somatomedins inhibit growth hormone secretion. Low blood glucose level always increases growth hormone secretion. High blood glucose levels or hyperglycemia, kindly make a note of this point, always inhibits growth hormone secretion. Hyperglycemia inhibits, somatomedin inhibits, a very important MCQ concept. This table is about factors increasing and decreasing the secretion of growth hormone. The next important MCQ section in growth hormone is about the factors which are produced by growth hormones. Look here, these factors are called as somatomedins. What is the point you should remember here? They should be listed one by 1, 2, 3, 4 like this. First thing, growth hormone acts in one body organ to produce these substances which are called as somatomedins. MCQ. Which body organ produces somatomedins? The answer is none other but liver. Liver contains receptor for growth hormone. Whenever growth hormone acts here, it produces a substances which are called as somatomedins. Simple. Second MCQ. Somatomedins are also called as a very important term, insulin-like growth factors. Very simple. Their actions resemble insulin. Third important thing. Growth hormone produces somatomedins. This somatomedins inhibits growth hormone. What type of feedback is this? Negative feedback regulation. 3 points over. Fourth important point. Look here, there are two types of somatomedins. Insulin-like growth factor 1, insulin-like growth factor 2. Common repeat MCQ. In adults, the most important insulin-like growth factor is IGF-1. Kindly make a note. Adults is IGF-1. Very important for bone growth. What is the MCQ concerned with IGF-2? It is the most important somatomedin required during a fetal development. Intrauterine life, fetus, the most important growth factor is insulin-like growth factor 2. 1 for adults, 2 for fetus. It was recently asked as a OGMCQ. Kindly make a note here, IGF-2 growth during fetal development. Remember this concept? Lot of MCQs. Somatomedins comes from liver. That is what I mentioned here. Now what are we going to discuss? Ultimately, we have discussed lot of points in growth hormone, but in physiology, the actions of growth hormones are very important. The ultimate MCQ section. What are all the actions of growth hormone? It is the common theme they ask you MCQ as, which is considered to be the direct action of growth hormone, which is considered to be the indirect action of growth hormone. It is the one you have to look in questions. Direct is what? Indirect is what? What is the concept? Anything concerned directly with the growth hormone is called as direct action of growth hormone. Simple. Common sense. Why these substances are called as somatomedins? They mediate the action of growth hormone. So automatically, any action produced by somatomedins is considered to be indirect action of growth hormone. Very simple. Now the basic concept we have underlined. Look here, direct action of growth hormones are all these actions. Indirect action mediated by IGF is all these actions. The second trick to answer this type of questions. The other name for somatomedins is insulin-like growth factors, which means that all the indirect actions are going to be insulin-like. All the indirect actions are going to be insulin-like. Exactly opposite. Direct actions of growth hormone are going to be anti-insulin-like. Remember that. Very simple. First we will look into the direct action. Anti-insulin-like, it decreases insulin sensitivity. It causes lipolysis. Both are anti-insulin-like effects. But on the other hand, if you look, indirect actions, they are typically insulin-like activity. Here direct lipolysis, here indirect anti-lipolytic activity, that's all. It is this concept they check. The ultimate point to remember here is one last thing. Even though there are direct and indirect actions which are opposite, is what I told, there is one action which is common for both growth hormone and somatomedins. MCQ. What is going to be that action? It is none other but bone growth. At the level of bone growth, both direct and indirect actions are same. All the other body regions, the actions are opposite for direct and indirect actions. Simple. That is the take home message.